this outbreak is not over.
Dr. Ian Crozier is one of thousands upon thousands affected by the Ebola virus.
It turns out that I'm really not different from 10 to 15,000 West African survivors.
Dr. Crozier was born in Zimbabwe, but is an American citizen, a doctor who was specializing in infectious diseases in Uganda when he heard about the unfolding Ebola crisis in West Africa.
I'm one of many people who've gone towards this tragedy in an attempt to do something about it.
He headed to Sierra Leone to help and ended up contracting Ebola. Dr. Crozier became very ill and eventually had to be flown across the Atlantic to Emory University Hospital in Atlanta. He is now Ebola-free.
It's fairly certain that I would have been dead in a week had I not left Kanama and come to Emory.
He spent the day at Denver Health, one of 9 hospitals just chosen by the federal government to be a regional Ebola treatment center.
So we have a designated space that would be sealed off from the rest of the hospital. A team would be called in, and they're available 24/7.
Which are some of the people, doctors, nurses, other healthcare providers, listening to Dr. Crozier share his Ebola experience, both as a doctor and a patient.
You know, I call it a dual citizenship.
One that has left him with a number of residual effects, including fatigue, arthritis, and among the most visual, a change to his left eye, which temporarily changed color and lost sight because of Ebola.
I expected that I had lost the eye, and then it really made a Lazarine return in January.
Experiences he hopes can translate into better treatment for Ebola, both here and abroad.
And maybe it's part of my own healing to try and make sure that what we've learned from a few survivors can be translated quickly and effectively. We've got to think about this world as a very small neighborhood and a small community.